Hello friend, this is WAJED. Today I am going to discuss one more important topic, that is classification of oral hypoglycemic agent or anti-diabetic drug. The first class, that is biguanides. The available dose 250 milligram and 500 milligram of metformin. That is the mainly used drug in that for diabetes patient. And number 2, that is sulfonylureas. The example of sulfonylureas, that is glimepiride. The available dose of glimepiride, that is 1 milligram, 2 milligram and 4 milligram. And number 3, that is DPP4 inhibitor. DPP full form is dipeptidyl peptidase inhibitor. So the example is sitagliptin. An available dose of sitagliptin, that is 25 milligram, 50 milligram and 10 milligram. Meglitinides. The example of meglitinide, that is natiglitinide, 60 milligram and 120 milligram. And alpha, and next is that is alpha glucosidase inhibitor. Example is VOGLIBOSE, 0.2 and 0.3 milligram. That is the available dose of VOGLIBOSE. And next is that is thiazolidine D1. It is otherwise called glitazone. That is available dose of glitazone. In that glitazone class drug, that is pioglitazone. Pioglitazone available dose 15 and 13 milligram. 15 and 30 milligram. And the drug mainly used for type 2 diabetes mellitus. Type 2 diabetes mellitus otherwise called non-insulin dependent diabetes mellitus. And in case of diabetes, type 2 diabetes mellitus, decreased production of insulin or decreased cell sensitivity to insulin. And one more thing, that insulin is a hormone, is a peptide hormone produced by the beta cell of the pancreas. And one more important thing that I should add, that is insulin decrease blood glucose level. Insulin can't maintain the blood glucose level, or it not balance the blood glucose level, it decrease the blood glucose level. So we'll see that example of that our drug, that is metformin hydrochloride and glimepiride combination. Metformin come under biguanides. And one more important thing that I should add, that is in that biguanide one more drug was available, that is fenformin. Fenformin is banned because of lactic acidosis, so that purpose the drug is banned. And glimepiride, that is come under sulfonylureas. And if you see the dose of the drug, glimepiride 2 milligram, as we know from that is glimepiride 2 milligram, 1 milligram, 4 milligram. So here they add that is 2 milligram dose, and metformin hydrochloride 500 milligram, and they add that is excipient. Excipient is nothing but additives. There is no pharmacological action of the excipient for the coloring agent or flavoring agent. That purpose that they are adding. And color they are using, that is yellow oxide of iron. So that is the information about that classification of oral hypoglycemic agent, and that is the practical example of the drug. So quickly we will going to revise, that is biguanides. In that biguanide, metformin 500 and 250 milligram, sulfonylureas, glimepiride, available dose is 1, 2 and 4 milligram. DPP4, example is sitagliptin 25, 50 and 10 milligram. Meglitinide, example is natiglitinide 60 milligram and 120 milligram. Alpha glucosidase inhibitor, that is example of VOGLIBOSE. Acarbose also there, that is VOGLIBOSE, available dose is 2.2 and 0.3 milligram. And thiazolidine D1, and it is otherwise called glitazone. Glitazone dose is pioglitazone, that is 15 and 30 milligram. This is all about the information about the classification of oral hypoglycemic agent. Thanks for joining with us.